Imagine trusting an AI for health advice, only to end up hospitalized with severe psychiatric symptoms. That's exactly what happened in a recent alarming case that raises serious questions about relying on artificial intelligence for medical guidance. But here's when it gets controversial. Can we truly depend on AI to replace human doctors for something as critical as our health? This story revolves around a man who aims to boost his well-being by cutting down salt, sodium chloride, in his diet. Like many people today, he turned to the popular AI chatbot, ChatGPT, for a quick replacement suggestion. Unexpectedly, the AI recommended sodium bromide. Intrigued, the man purchased sodium bromide online and started using it as his salt substitute. Now, sodium bromide is chemically related to sodium chloride, but its common uses are vastly different. While sodium chloride seasons your food safely, sodium bromide is mostly used in industrial applications, like sanitizing hot tubs, and is not intended for consumption. The AI, however, failed to clarify this critical difference, a detail that most people would find difficult to spot on their own. 3 months later, the man was rushed to the emergency room. He wasn't just feeling unwell. He was enduring terrifying paranoid delusions, convinced his neighbor was trying to poison him. His condition swiftly deteriorated with intense paranoia, hearing and seeing things that weren't there, and even trying to escape the hospital. Doctors had no choice but to place him under an involuntary psychiatric hold due to concerns about his safety and mental stability. After administering antipsychotic medication to stabilize him, the man revealed his self-devised AI-inspired diet. This clue, combined with laboratory tests, allowed medical professionals to diagnose him with bromism, an unusual and rare toxic condition caused by excessive bromide buildup in the body. Normally, healthy individuals have bromide blood levels under 10 milligrams per liter. This man's levels were shockingly high, measured at 1,700 milligrams per liter, far beyond safe limits. Bromism isn't a new condition. In fact, it was a relatively common diagnosis in the early 1900s and accounted for up to 8% of psychiatric admissions back then. However, as bromide-containing drugs fell out of favor in the late 20th century, bromism cases nearly vanished. Fortunately, after 3 weeks of medical care, the man recovered and left the hospital without any lasting effects. Still, this case isn't just about a forgotten illness making a comeback. It underscores how far current AI technology still has to go before it can safely replace expert human judgment, especially in fields as complex and personal as healthcare. As the authors of the formal case study caution, ChatGPT and similar AI systems can produce scientifically inaccurate information, lack nuanced critical thinking, and, unfortunately, contribute to misinformation spreading. A trained medical professional would hardly recommend sodium bromide as a substitute for salt due to its toxicity. This eye-opening research was published in the Annals of Internal Medicine Clinical Cases, reminding us to treat AI health advice with caution, skepticism, and always confirm with qualified healthcare providers. So what do you think? Could AI ever become reliable enough to offer medical recommendations safely? Or should we be wary of blindly trusting algorithms with our health? Share your thoughts and experiences in the comments below. Let's discuss the fine line between innovation and risk.